So if you see the rapid pace of innovation that's happening in healthcare, right? And earlier in the stage we were talking about how for electricity to reach 1 million houses, it took 150 years, but for ChatGPT to be in 1 million users, it took essentially 5 days. So the pace of innovation in AI is so fast that it became important to have a very focused conversation between research scientists, decision makers at the C-level and doctors on how AI is going to help you and I when we go to a hospital to improve the quality of care. So the vision of this conference was to have those rich conversations about the future of healthcare, how technology can help improve patient outcomes, patient services and also healthcare systems. How can we serve 1 million customers, 1 million patients, 1 billion patients while providing higher quality of care at lower cost and faster outcomes?
Thank you for that wonderful question of what is most important. One of the most important things for every patient is to know that artificial intelligence is transforming the way healthcare will be delivered. And Apollo Hospitals intends to be at the forefront of this. We are very impressed by the tremendous work happening by your government, and we look forward to partnering in some ways so that we can help accelerate this great work. We will build joint frameworks. Her Excellency was very impressed with our ethics framework around AI. We will share those models, but we will work deep with the single common goal, that is affordable, accessible healthcare for everyone based on the principles of proactive, preventive, personalized. And these will therefore create a better healthcare system. We will use every technology possible to keep our populations healthy.
Just to start, I'm providing a perspective from the World Economic Forum. So, when we're looking at AI and healthcare, we're thinking from a global perspective about how can we, in an era of a lot of global challenges and sort of fragmentation, how can we look at healthcare as a field where we can actually collaborate? Because we see a huge potential with healthcare shifting to a new mode of digital and AI for increased collaboration that could actually help populations around the world. So for example, if we develop algorithms in one part of the world, why should we redo that in 100 different countries, which would waste a lot of time? Are there ways that we can actually cooperate that would help patients in a global context? So that's, I think, something really important. And for global convenings such as these, we need actually more of these. So I'm really excited that this conference is happening, especially in a very international place like Dubai, like the UAE, to start bringing these voices together. So there's still a long way to go in this revolution, but I think that this is a very important convening, and we should see more of these going forward as well.
I'm visiting here Dubai to attend the AI conference in healthcare. I think AI has revolutionized our life. Today, I've used AI already 7 times. I'm using it for direction, I'm using it to understand what to do for my next talk, I'm helping it make my slides. But at the same time, AI can revolutionize lives. If you think about healthcare, there's only about 2 billion people who have very good care or access to care. There's about 6 billion people on earth who have no care. Can AI make a difference in that? And that is the question we should answer. I think the answer is yes. What we need to look at is, are there things which we are doing which can save lives, which AI can come in and help the doctor and the nurse and everybody else in the health ecosystem do their job better, do it correctly? Imagine aviation, imagine finance. They are completely interconnected, seamless across countries and borders. You can go from Dubai to America to India to any other country without problems. In health, we don't have that situation. In health, we need to make sure that we are able to interact, integrate, augment, assimilate, and do things together.